So please start your session.
Thank you. Good afternoon, doctors. Welcome to this experience sharing program on managing PPH, case studies from labor room, experience with Carbetocin. Doctor, this program is brought to you by Hetero Healthcare. Hetero Healthcare, for a snapshot, we have 25 plus years of excellence with 36 state-of-art manufacturing facilities. We have 300 plus products in our portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally and is amongst the largest closely held pharmaceutical company in India. Hetero Healthcare is amongst the largest manufacturers of ARV, APIs, and FDFs in the world and has Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh. Hetero Healthcare, the 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. Today's program, the Experience Sharing Program on Managing PPH, we have got Honorable Speaker Dr. Anusha Reddy with us as a speaker. Welcome, Dr. Anusha Reddy. Dr. Anusha Reddy, Madam is MBBS DGO DNB in obstetrics and gynecology. Madam is consultant in obstetrics and gynecology, infertility specialist and laparoscopic surgeon from Vanasthali Hospital, Vanasthalipuram, Hyderabad. Welcome, Madam, and over the session to you. Madam, I'll run the slides. You tell me next. Yeah.
Yes. Thank you, sir. Thank you for having me here. I would like to thank Hetero Health for giving this opportunity and giving me a chance to share my experience in postpartum hemorrhage and how I deal with the cases and the best drug to be chosen for PPH. Now, let's start. We'll discuss briefly about the postpartum hemorrhage. PPH is a very most common cause of maternal mortality all over the world. Before understanding PPH, we should know the definition of it. The PPH is loss of blood, at least 500 ml of blood loss during the vaginal delivery, and if it is more than 1 liter of blood loss following cesarean delivery, is considered as PPH. It is the most common cause, and it can occur in every woman who are at risk or who are not at risk. PPH is the leading cause of maternal mortality in low-income patients, low socioeconomic conditions, and primary cause of nearly 1/4 of all maternal death globally. It is very unfortunate, but it is very common. The leading cause of maternal mortality it is the leading cause of maternal mortality, accounting for about 35% of maternal deaths. And MMR in developing countries was 240 per 1 lakh live births compared to 16 in developed countries. When global PPH incidence includes 40 million women suffer from PPH. Incidence of PPH is reported as 2 to 4% after vaginal delivery, whereas it is 6% after cesarean section. The incidence of PPH in India, 38% of maternal deaths are due to PPH. Among them are due to PPH, and in globally, 25% of global deaths takes place in India, and 2/3 of these are attributed to PPH. India has unexpectedly high maternal mortality death rate of 540 patients per 1 lakh live births. Next. Yeah. The etiology of PPH is 4 T's. Number 1 is stone, which is most common in case of uterine atony. That means inability of the uterus to contract and retract, which may lead to continuous bleeding. And the next one is thrombin. It is seen in coagulopathies. The third one is trauma. It is seen in any injury to the birth canal, uterine rupture or uterine inversions and any lacerations. And the fourth one is in case of retained placenta or adherent placenta. Next one. Next. So how will you diagnose postpartum hemorrhage? First, initially, we have to assess the patient. We have to check for the vitals, presence of tachycardia and hypertension, assessment of other vital signs, and the estimation of blood loss needs to be checked first. And after that, examine the patient, assess the entire genital organs for lacerations or any hematoma or any signs of uterine rupture. Manual examination for retained placental tissue should be examined. And if you have ultrasound nearby, you can check it for the atonicity, and uterine inversion can be checked. And lab investigations to check out any coagulopathies, and to know the hematocrit values and platelets, and assess the fibrinogen level. Next. So, how will we approach towards PPH? In case of poor uterine tone, if there is a tonic uterus, first we have to check for the palpate. We have to palpate the uterus. We feel flabby, boggy uterus, which is very soft, and if the uterus is more than above the umbilicus, so we can suspect the blood clots inside the uterus, and uterine cavity is filled with the blood. So investigations, full blood count, coagulation profile we have to send, LFTs, RFTs we have to send, and if ultrasound is available, we need to for any uterine rupture and intraperitoneal bleeding. So management includes, first of all, medical management by uterotonics like oxytocin, prostaglandins, and ergotolcolides, and uterine balloon tamponade can be used. In case of tears and trauma, find the cause, repair the cause. And in case of retained tissue, manual removal of placenta should be done, and followed by, in case of coagulopathy, correct the coagulopathy, and plan for multiple transfusions of blood and blood product. Next. Next. Yeah. Okay. So, use of uterotonic agents. Most commonly, the molecules which we use are oxytocin, carbetocin, ergometrin, symptometrin, misoprostol. Some of them particularly used for prophylactical, and some of them for therapeutically. So, we can administer at the time of usually, we administer at the second stage of labor, or following the delivery of placenta, sometimes before delivery of the placenta in case of high-risk patients. Prophylactic use of uterotonic, it prevents PPH, and it helps in active management of third stage of labor. In therapeutic use, it helps in management of PPH. Next. So the difference between the oxytocin and carbetocin here. Okay, now if we talk about the Carbetocin, we should know how effective it is, how efficient it is uh, than oxytocin. Previously, we all use oxytocin, then Carbetocin, how effective it is, how effective in preventing PPH. What is the difference? We should, before that, we should know the pharmacokinetics of oxytocin and carbetocin. The brief discussion includes this. Brief description of oxytocin includes: oxytocin is a synthetic cyclic peptide form of the naturally occurring posterior pituitary hormone. It binds to oxytocin receptors in the uterine myometrium, that stimulating the contraction of this uterine smooth muscle by increasing the sodium permeability of uterine myofibrils. Whereas a heat-stable carbetocin, it is long-acting synthetic analog of oxytocin with agonist property, binds to oxytocin receptors in the uterine smooth muscles, resulting in rhythmic contractions, increased frequency of existing contractions, and increased uterine tone. Uh, uh, when it comes to the pharmacokinetics, oxytocin, if you give intravenously, the action is immediate action with peak concentration after 30 minutes. Whereas when it is given intramuscularly, it is a slower onset of action. It takes 3 to 7 minutes, but produces a long-lasting clinical effect of up to 60 minutes. Whereas its half-life is 1 to 6 minutes. When it comes to heat-stable carbetocin, when you give IV sustained, when you give IV or carbetocin, it gives sustained uterine contraction within 2 minutes, and that lasts for about 6 minutes, and followed by rhythmic contraction for 60 minutes. When it is given IM, sustained uterine contraction lasting for about 11 minutes, and rhythmic contractions for about 120 minutes. That means it is almost double than the oxytocin. So best thing about the Carbetocin that is like heat stable. It doesn't require any refrigeration. It doesn't require any cold chain storage. Whereas in oxytocin, we need to maintain the temperature of 2 to 8 degrees continuously to preserve its activity. And oxytocin is used in induction of labor, where carbetocin we cannot use. And yeah, oxytocin can be used in augmentation, but carbetocin is not used. It is used in prevention of PPH. And carbetocin actually it is used in treatment of PPH also. Next one. Next slide. So WHO Champions trial. Uh, Here actually the main intention of this WHO champion trial, it has compared both carbetocin and oxytocin. So it has concluded that carbetocin was non-inferior to oxytocin for the prevention of blood loss of at least 500 ml or use of additional uterotomic agents. When comparatively, the blood loss of more than 500 ml or the use of additional uterotonic with carbetocin is 14.5%, and the oxytocin is 14.4%. It's just 1.1% difference. And whereas in case of blood loss of more than 1 liter, the efficacy of carbetocin is 1.5%, 51%, whereas oxytocin is 1.45%. So here also it is better than oxytocin. At least one anticipated AE, the safety with carbetocin is 4.9, whereas with oxytocin it is 4.7. And at least one serious AE, the safety with carbetocin is 0.7%, whereas with oxytocin is 0.6%. Here also it is a little bit on higher side, and it is non-inferior to oxytocin. So the frequency of blood loss of it, yeah. Next, the Cochrane review. Okay, the frequency again. Maybe it's not okay. Cochrane review also, it has Cochrane also reviewed like carbetocin for preventing postpartum hemorrhage. In this study, data was collected from 11 studies involving 2,635 women. So the author concluded that for women who undergo cesarean section, the carbetocin resulted in a statistically significant reduction in the need of therapeutic uterotonics compared to oxytocin. Also, carbetocin is associated with less blood loss compared to symptometrin in the prevention of PPH for women who have vaginal deliveries, and is associated with significantly fewer adverse effects. Yeah, some of the guidelines recommended to use carbetocin in prevention of PPH prophylaxis. So WHO in 2018 included carbetocin in PPH prophylaxis, whereas Canada, also SOGC of Canada included carbetocin 100 micrograms IV bolus as a PPH prophylaxis, whereas in New Zealand Ranzok study also included carbetocin in active management of third stage of labor. And FIGO also included carbetocin as one of the recommendations for PPH management. Germany's Swiss body also included carbetocin 100 micrograms slowly IV. And FCOG France, that is champion trial, which proved that carbetocin are proving non-inferior to oxytocin. Next. Yeah.
Madam, coming to your experience with carbetocin,
Yeah.
since
Yes,
how
sir.
long you have been using carbetocin?
So almost 4 years. Previously, for 2 years, I just used it for only few cases. But when I found the advantages of this carbetocin, I'm almost using to every case.
You use generally intravenous or intramuscular route?
Sir,
You use intramuscular or intravenous route?
intravenous. I
Intravenous.
most it depends upon the case, sir. Actually,
Any
so in case
specific
of an Yes,
Yeah,
yes.
yeah, yeah.
In case of high risk cases like multigravida, twin pregnancies, and if I anticipate PPH, in such cases, I'll add IV bolus. In normal cases, in every normal delivery, every cesarean, I'll use IM.
And madam, any specific case you would like to describe to the audience wherein use of carbetocin almost
So
prevented
in
a...
case of, especially in twin case,
Hmm.
I had an emergency surgery with twin. Obviously, twins are always maximum most of the
Yeah,
time
yeah.
emergency. So she had actually very less hemoglobin, around 7 HB. She came to me with leaking PV and had to do surgery. So in such case, I my main motto is to prevent PPH.
Correct,
In
correct.
such case, so after delivery of the second twin, I asked my anesthetist to give IV bolus of Carbetocin. In such case, I actually counted less than 800, less than 1,000. It's
Oh,
almost 800 ml of blood loss in twins.
that's great.
Immediate uterine retraction, and it helps to prevent PPH. And I didn't need to transfuse blood after that.
That's great. That's great. No?
That
Because twins are always prone for PPH. I mean, overextended uterus
yes,
becomes,
yes, sir.
the tone is
And
affected.
also twins, sir. Two high
Yeah,
risk cases in
yeah,
that.
yeah, yeah. And anemia, I suppose, is a major cause in our country, a precipitating cause of PPH.
Yes, how much ever we prescribe, but still we can't.
Yeah,
Especially, I work in both periphery and also in the city, sir. In
okay,
periphery, I actually prefer carbetocin because it is easy to maintain. I don't need to use any refrigerator or anything.
correct. And
Always it will be there in my OT.
absolutely.
Yes, immediately after delivery of my baby, after the baby, I always, before giving incision only, I'll tell the anesthetist, load the Carbetocin, it's okay. After the delivery of the baby, give it. Before expulsion of placenta,
Correct.
I have a habit of giving the Carbetocin.
That's right.
So I can see blood-free area, actually. It won't be
Yeah.
soiled.
You
My OT won't be so much soiled with blood.
correct. In
Yes,
peripheries, the
yes.
major advantage is that, I mean, you don't require a refrigerator, which is a problem in peripheries with power outage, which happens in cities also.
Yes,
Yes. And a single dose. These are all
yes,
advantages. You don't require a drip. I mean, you can even use iron
yes.
pump. Yeah.
When it comes to the money also, it's okay, sir. 200-300 doesn't matter.
No, no,
For
no,
me,
no,
we
no.
can save after
These days,
doesn't matter,
yeah,
and
correct.
people won't take the iron
Risk.
supplements after delivery. At least we can save the blood loss.
I know, I know, I know.
And that's what I calculate.
And
Yes,
rightly so. People today want the best wherever they are. And I mean,
yes. I
PPH is
actually
like
suggest everyone to use Carbetocin instead of, if
absolutely,
it is like
absolutely.
unavailable, if it is out of stock, then only.
That's a
Yeah,
different story.
actually.
Yeah, yeah.
Yes, sir.
Now, besides twins, any other patients who can, when whom the doctors can anticipate a PPH?
Yes, sir, as I said, in high risk cases, always every pregnancy we can't actually normal primary also sometimes end up in atonicity. So always every pregnancy is a high risk pregnancy for me.
I mean,
Always keep ready everything.
the correct
And but in
answer.
high risk cases, you should be a bit more.
Absolutely, absolutely.
Yes.
And in gynecology, one can never say a normal pregnancy when it will suddenly become a high risk. I mean, it is only, we have seen
Suddenly the
patients.
uterus will become.
Yes,
Yes,
suddenly
sir.
becomes flabby.
Yes, sir.
Any experience, madam, of use of carbetocin in retained placenta?
Yes, sir. Actually, I have done a few cases of retained placenta
Oh,
and not only retained, adherent placenta,
uh-huh.
placenta percreta. I have done 3 cases of placenta percreta. In those 3 cases, I didn't remove the uterus.
Array, that's great.
Along with the carbetocin, I have used uterotonics. Along with it, I immediately ligated
Carbet.
the ovarian vessels and uterine arteries. After uterine arteries, and again, I have started bed suturing.
Okay.
So both I have used these uterotonics, and my surgical skills actually helped to save the uterus. That
Yeah,
was
yeah,
my
yeah.
main motto, especially placenta um, percreta when it is completely covering the os. Placenta percreta with complete placenta previa. In such case, if we remove the uterus also, we can't control the bleed
No, no, no,
because
no.
the bleeding will be in the lower side.
Lower side.
If you chop the uterus in the upper end, it is of no use. So we need to concentrate on ligating the vessels. Along with that, we have We have to make the uterus retracted. So in that case, I don't not only use Carbetocin one dose, sometimes two, three doses also.
Very
Sometimes after
interesting.
every 10 minutes also, I'll give that headache to the
Understand.
anesthetist, and my anesthetist is also very comfortable because he'll have less side effects with the
Yeah, yeah,
Carbetocin.
yeah, yeah.
If we
And
give prostaglandins, again, patient will complain of vomiting,
no,
chest
no, no,
tightness,
no.
and oxytocin also again.
And you
So
cannot
he
give prostaglandins
complains.
in asthmatics, na?
Yes,
Again,
asthmatic. There are so many
yeah, yeah.
contraindications.
Methergine
So
again in hypertension. All those things are there.
yes,
Yeah,
ergometrin I can't. Methyl
correct,
ergometrin I can't give to
correct,
the
correct,
hypertensive
correct,
cases. So carbetocin, another use is less complications,
correct, correct.
less side effect. Patient won't irritate us actually.
This,
She won't vomit. The nausea, vomiting sensation,
and
chest tightness are less.
it's honestly, it's like this is the golden moment of their life, and suddenly patient starts vomiting. Is not. I mean, people will like to
True,
avoid
sir.
that. Na. It's a lovely
True,
case,
sir.
huh?
Actually,
Yeah.
yes.
Any experience in case of RH negative mothers?
Yes, with RH negative, always we should be ready with the blood, but still we
Yeah, yeah,
have to we have to avoid the PPH. We don't want any
correct.
PPH in that case. 100% I'll use a Carbetocin, and that is very good. And there is no contraindication
Yeah,
actually. We can use in RH negative pregnancies because it is hardly to get negative blood group. So always
correct.
keep this Carbetocin aside.
Now, many doctors will use oxytocin for induction. I mean, we all use. Can a doctor use carbetocin for prevention if oxytocin was used for induction?
Yes, yes. Oxytocin is for labor
Yeah,
augmentation I'll use, but for prevention of PPH, I prefer Carbetocin.
carbetocin,
Yes,
correct.
yes,
Yeah, you have already said this. IV route you
yes.
prefer
IV
over
route depends upon the case.
the severity.
Depends
Yes,
upon anticipation.
correct, correct. Have you seen any side effect with carbetocin now
Yes.
that you have used it over 3, 4 years? Any severe side effect?
Mm, till now, I haven't faced, sir.
God
I
bless. You
haven't.
shouldn't also.
Yes, I
Good.
don't want also,
Yeah,
sir.
exactly,
I
exactly.
haven't.
Exactly.
Yes.
If the patient is not responding adequately with carbetocin, then what next? Whether dose can be repeated or you would use additional electrolytics.
Mm,
I think we would use everything that's
Most of the
available.
times I'll give, yes, along with the Carbetocin, sometimes I'll give, actually I'm repeating the dose.
Okay.
I'm repeating the dose.
Okay.
See, I can't use prostaglandin. I hardly use prostaglandins. And misoprostol is also a good idea, but it will take time, sir.
Yeah.
See, I can't wait 10 minutes. See, for rectal misoprostol, it will take 10 minutes. Onset of action for misoprostol is 10 minutes, sir.
10 minutes is a long
So
time in
instead of waiting
PPH.
for 10
Yeah.
minutes, yes. So I don't prefer misoprostol. Okay, after the procedure, I can use.
Correct.
But repeating the Carbetocin actually saves my time.
And patient also many times.
Yes, sir.
Advantage of carbetocin over other uterines. So already said the less side effect and easy to
Yes, yes,
manage. Yeah. We won't
yes.
discuss. Should it be kept as a reserve drug or a first line? You have been using it as a first
For
line, but
me,
general.
actually, after I'm using since 4 years, sir.
Yeah, yeah,
From
yeah.
2 years, I'm keeping it as a first line drug.
First line, right.
Yes.
And once we get confidence, we always keep it as a first line. Why keep it as a reserve if the drug is
First
good?
line drug because
Yeah,
why should I again go for
exactly,
oxytocin?
exactly, exactly. No,
What should I save?
no, no, correct.
Hardly I can save 200. It is of
Che,
waste.
che, che. It is
Yes.
said that if carbetocin fails, other drugs don't help. Is it true?
Mm, till now, I haven't faced this
No, but
practically.
yeah.
Frankly speaking, I haven't faced.
Okay.
I haven't faced that.
You have already told the role of anesthetist. I mean, both of you discuss and then
Anesthetists is
decide.
actually
Yes,
comfortable if I use
yes,
Carbetocin
yes, yes,
because
yes. Easy to
many
manage.
anesthetists they love to use Carbetocin, but they will hesitate to use because it is costly 200 rupees. But for me, I'll give that liberty for them.
Yeah, yeah, yeah,
You
yeah.
use Carbetocin, the patient comfort. She should not vomit.
Correct, correct, correct.
She should let me do my work. Yes, sir.
And to conclude, what is your take-home message for the audience who have attended this?
So, when compared to other uterotonic, I felt Carbetocin is best. See, it's like asking again, open hysterectomy is better or laparoscopic hysterectomy. I always say lab. When you have an
Absolutely.
advanced thing, why you want to go
Correct,
back?
correct,
That's
correct,
what I
correct,
say, sir.
correct.
When you have a very advanced drug in your hand, why try back again? That's what my opinion. Always go ahead. That's it. If
Correct.
you can try the better drug other than Carbetocin. That's it. And
Yes,
again, I suggest other colleagues not to go back.
correct.
Try to use Carbetocin. When you have excellent drug in your hands, I don't want to try again.
Right.
Yes.
Madam, thank you so much. It was lovely sharing your practical experience with the drug. It was lovely. I mean, theory is one part. And that's exactly what our audience wants. Although there are many literature, our own doctor's experience will matter to them for use. It gives them a
Yes, sir.
confidence. The case
Yes.
that you described of twins at sudden emergencies and cases of retained placenta are lovely. I mean, I'm sure the audience has got a lot of insights into it. Thank you so much. Thanks,
Yesterday
marketing.
itself, sir.
Ah,
Yes,
yeah,
sir.
yes.
Thank you, sir.
Thanks,
No, no, no.
marketing.
Yesterday itself,
Yes.
I had done one retained placenta.
Oh,
I had done one recent placenta. Under ultrasound guidance, I used oxytocin as a main drug.
okay. Because
I
oxytocin
asked,
is.
I used 2 ampules of carbetocin. Sorry, not oxytocin, carbetocin. Sorry. I actually used 2 ampules of carbetocin, not 1 ml. For that patient, 1 ml was not sufficient.
Correct.
So because it took a lot of like almost 15 minutes time, even though in the ultrasound guidance, but actually carbetocin helped me.
The best
When the
part,
uterus got contracted, the placenta automatically comes out.
the
So it has given a clear picture. That's what.
the
So
best part is
yesterday only I
patient.
have
Yeah.
operated. Yes.
No, the best part of all this is patient was saved.
Yes, sir. Stay. Yes.
Absolutely. Thanks so much, and thanks marketing team and sales team for coordination. Thanks IT team. Thanks Nagadevi for IT support. Madam, thank you. It was a lovely hearing your practical experiences on Carbetocin. Thank you so much for sharing.
Yes.
Thanks, and wish
Thank
you
you,
very
sir.
good afternoon. You can log off, madam.
Yes.
Yeah.
Yes.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you. Thank you so much,
Thank you. Thank you.
Nagadevi, Dr. Prashant.
Thank
Bye.
you. Thank you.
Bye.
Bye.
Bye
Bye.
bye.